One situation you may have to deal with is dealing with someone who's choking. Now, choking is divided into two main groups. There's mild choking and severe choking. Now, mild choking is where you have a blockage in the throat, however, air can still pass through. So this person is going to be coughing, they're going to be breathing heavily, they're going to be in a lot of distress, but the air can pass through. So you will hear them making noise, you will hear them coughing, they may be able to talk. An example of a mild obstruction could be a fishbone that's caught in the throat. The procedures are to try and calm them down the best you can, allow them to cough, and hopefully they'll expel the object. If they don't, then you're going to need to get them to medical help and call the EMS, because you're not going to be able to take the obstruction out of their throat. So the next group are the severe airway obstructions. Now, a severe airway obstruction is a complete blockage in the throat. It could be that you're in a restaurant and you've eaten a very large lump of steak, just swallowed it, which often happens where people are laughing or talking and eating at the same time. That can cause an obstruction, or rushing their food. If the lump of steak got stuck into the throat, there's no air passing. So with this person, they're not going to be able to cough. They're going to be very, very distressed. They are going to be passing out in a very short space of time, just a minute or just over a minute. And this person is going to need help immediately. So with this person, we're going to need to approach them, get their consent. Now, one of the things you can say to someone is, are you choking? It might seem a bit of an odd thing to say, but the reason we say, are you choking, is we want them to get a reaction from it. If they say yes, it means that they're not choking in the sense of the procedure we're going to be talking about next. If they can't answer you, then you're going to have to look for other signs. Now, one of the universal signs of choking is hands to the throat. If you say, are you choking? They might nod, or they might indicate you to come over, anything like this. This is all consent. We go through within first aid, you still go through your first aid cycle, your consent side, but in order to gain that consent and know they're choking, it's not only verbal, they're not going to be able to talk to you, it can be other signs that you look for. What we're going to do is do two key procedures. The first one will be 5 back slaps, and the second one will be 5 abdominal thrusts, and then we repeat that. So with the demonstration of how to deal with choking, the first things you're looking for are signs. So if Matt was choking, he'd be having his hands to the throat, and then I would ask, are you choking? Now, he can't answer me, so he's going to nod. You're seeing his face, you'll see he's turning red, he's trying to breathe, he's going to be very distressed. So what you can then do is move through to the back blows. The first thing we do is take one arm and just lay it forward, and just lean him forward slightly. And we're going to deliver 5 back blows as individual blows between the shoulder blades. And it will literally be 1, 2, 3, 4, 5. Between each one, I'm looking down to see if the object has been expelled. If it has, I'll then stop and allow him to cough. What I then do, if that hasn't worked, and I need to do abdominal thrusts. So I need to get the thumb side of my fist in against, just below above his belly button, in here. So you're not pushing on the rib cage, you're doing below the rib cage. The other hand is going right the way around, and then we're giving an inward and upward motion. So it'll be literally in like this. Now, I won't do this fully because it will could cause him injury. So it'll be literally inward, 1, 2, 3, 4, and 5. And if that hasn't worked, I can leave my arm there and go back to 1, check, 2, check, 3, check, 4, check, 5. So it's 5 back slaps, 5 abdominal thrusts, and then you repeat that until the object comes out or he becomes unconscious. One advantage of having your arm round here is if he did become unconscious, you can lower him into the ground. And once you lower him to the ground, you would then start CPR at the chest compression stage. You know he's not breathing, he's been choking. So you would start CPR at chest compression stage, because the trapped air in his lungs, as you push down on the chest, the hope is that trapped air in the lungs will force against the object and expel it out the body. Finally, if you had to do the abdominal thrust on a pregnant lady, then you can't do it down into the stomach, so you do what's called chest thrusts. So this would be exactly where we would do the CPR compressions. It's fist side straight in the middle of the breastbone, and you would pull through onto the chest in the same manner as you would down on the stomach, but you're pushing on the chest. This is the only option you've really got, because there's no other way round of doing it. If you couldn't get your arms around someone's waist, then again, you could move up here and do chest thrusts if you needed to.